My right knee has got osteoarthritis because I've had 7 operations. I do extreme, sports, and it's prevented me from enjoying those activities. The biggest challenge with this knee is pulling when you go on these expeditions, heavy objects behind you, 55 kilos for days. What I would hope to do that, I may come back just before I go on this big climb, and to be able to do the climb successfully and carry on for as long as I can with the knee. And to be honest with you, my interactions with the team prior to come here was very good. They're very professional staff, and the team, I think everyone's been really good. Very knowledgeable, very caring, which is what I guess people would want.
Hello and welcome. Pleasure to see you here in Swiss Medica's facility. Would you be so kind to introduce yourself to our viewers and tell us what brought you to Swiss Medica?
My name is Alan Nielsen. I'm from the UK, but I live in Switzerland now. What brought me here is mostly my right knee. My right knee has got osteoarthritis because I've had 7 operations over the past 20-something years, and I do extreme, sports, and it's prevented me from enjoying those activities. And more recently, I had an operation on my shoulder.
Now, you mentioned that you enjoyed previously a lot of extreme sports and that you were in rugby, correct?
Well, initially. Yes. A long time.
Could you tell us a little bit about what kind of extremes you were into and what do you miss?
More recently, I mean, I did martial arts, I did boxing, but I think more recently I've been to both the North Pole and the South Pole, and I climb mountains. So the biggest challenge with this knee is pulling when you go on these expeditions, heavy objects behind you, 55 kilos for days. And in 2014, when I went to the North Pole, when I got back, my knee was very badly swollen because of the stress of going there for days of pulling the weight. So I went to the surgeons in London, and they wanted to replace my knee. But I didn't want to do that because from all the research that was available at the time, I felt it was better to preserve the knee. So I had a number of injections, with PRP and cortisone, etc. They helped a bit, but eventually I was going on a big climb in Ecuador in 2022. When I returned from that, I did three different climbs, and my knee again was really bad, particularly coming down because these are over 6,000 meter climbs, so kind of a lot of stress on the knee. And I decided I wanted to have a go at stem cells, so that was when I decided.
And from our private conversation, I understood that you had abroad. But your first treatment was in different
I had one in the US last year. I did a lot of research, and I genuinely can't remember the name of the clinic in Florida somewhere. So I had treatment there. I think it helped. They told me it was going to take 3 months to take effect. And so I wanted to have a top up. I wanted to, because I'm doing another big climb later this year. Just to get the knee and general health in as good a shape as possible,
So do you have like a pain or like a regular chronic ache or something of the sort?
No, I don't.
It's just mostly when you overload yourself with activity, right?
Because I've been active, I kind of work on my general muscle strength around my legs and general overall body health. And I think when I keep fit for every day, it's fine. I mean, I do water sports as well, and I'm kind of fine with it. But when I stress the knee really badly, particularly climbing or pulling over a long distance, then it swells up. It reacts because I've got no meniscus has been removed, so I've got bone-on-bone action, and that swells the knee. Or hard skiing, I do some hard skiing. So otherwise, day to day, I'm fine. But I think I'm more of an exception. I'm not saying that because I keep the muscles really strong. Every time I don't, the knee starts giving me problems because the muscles can't support the joint.
And can you tell us about the procedure you have here? You mentioned in our private conversation that it was a bit painful and that your knee got swollen. And can you tell us, or to our viewers that are thinking about having the same procedure, can you walk us through the process?
I don't think it's particularly painful, actually. But then again, I've been told I have a high threshold of pain. So pain is a bit, I didn't find it particularly painful at the time. However, as I said, the last time I had it in the US was the same because my knee reacts to, so I guess the fluid being in there. So my knee swelled up for 2 or 3 days, but it's calming down already. So just icing it and resting it. So I don't think it's painless, but I don't think, if someone's seriously looking at having this done, I think the benefits hopefully outweigh the temporary discomfort.
And could you share with us, why did you choose Swiss Medica this time and not any other clinic for stem cell therapy?
Well, as I say, I did some research a couple of years ago and ended up going to the US. But this time, because I spend quite a bit of time in Switzerland, because that's where I live now. And I wanted somewhere that's local, more local than going to the US. And to be honest with you, my interactions with the team prior to come here was very good. They're very professional and very clear about what was expected. And I had a video conference with one of the doctors. Again, she was very helpful. So I felt confident that, this would be a good place to come.
And did that confidence not mislead you? Can you share with us your general experience with Swiss Medica so far? You're at the end of the treatment, I understand. And
yeah, I think it's been a good experience. I think it's a good facility from what I've experienced. I don't know how old is the facility, but there are some little bits in the room, that just general, sometimes the water pressure or little things like that, or the air conditioning. But I think in terms of the medical staff and the team, I think everyone's been really good. Very professional, very knowledgeable, very caring, which is what I guess people would want. So overall, I think I'm not disappointed with what I've experienced so far.
So if we would have to conclude, what would be your biggest hope from this treatment?
I guess, it's my knee's degenerated, so my expectations are realistic. What I would hope to do that, I may come back just before I go on this big climb, and to be able to do the climb successfully and carry on for as long as I can with the knee. What I don't know is whether one has to have this every year or, how long does the benefits last. But the hope is to keep going with the knee for as long as possible.
Wish you the best of luck, in your efforts to climb and continue enjoying activities that you do.